Our poster is on assessing availability patterns of metastatic renal cell carcinoma clinical trials in the United States. So for some background, regions of the U.S. with a higher socioeconomic vulnerability tend to have fewer clinical trials for the U.S., but this has not been previously reported. So we sought to evaluate the county-level distribution of clinical trials for mRCC across the U.S. So we used things like clinicaltrials.gov to find these clinical trials and re-enrolled the mRCC trials from June 1st, 2019 to June 1st, 2025. We also listed and mapped each zip code using the Postal Service data and the CDC's Social Vulnerability Index. So as you can see in figure 1 here, it's a bar graph, and this kind of shows that most counties in the U.S. do not have a clinical trial for mRCC at all, whereas maybe 100 and so have one, and so on. So in figure 2, it's a map of the U.S., and this shows the county level distribution of mRCC trials in the U.S. So where there's more yellow and blue, there's more clinical trials, and the red shows no clinical trials at all. So as you can see, this map, there's not a lot of clinical trials at all in the U.S. Overall, only 650 of all U.S. counties have at least one mRCC clinical trial location. Figure 3 is the county level SVI designation, and this is what we found to be the strongest predictor of mRCC trial availability. So where there's more red, and the darker red is the higher social vulnerability. So overall, counties with a higher social vulnerability tend to have lower trial availability. And so geographic disparities in metastatic renal cell carcinoma clinical trial access are largely driven by the socioeconomic and healthcare infrastructures factors.